Welcome, everyone. My name is Nathan, and I just want to welcome everyone to our virtual panel discussion on water quality and its impacts on our health. I'm with the All of Us Research Program, and today I'm happy to introduce Kate Robb, Deputy Director of the Center for Public Health Policy at the American Public Health Association, Dr. George Kraft, Professor Emeritus, UW-Stevens Point, and Director Emeritus, Center for Watershed Science and Education, and Dr. Mark Borchardt, microbiologist, and from the USDA-Agricultural Research Service. We are honored for these experts to share their time and experience with us this afternoon. I can speak for almost all that today, one thing we are curious to learn more about is how our water quality is impacting our individual environments. We all come from different environments, and it's important to understand how those environments impact us individually. In fact, one of the All of Us Research Program's focus is how our environment impacts our health. So to get things started, Kate, I'd like to open it up regarding water equity. And a question that we have for you is, what are social determinants of health and what is water equity?
Sure. Thank you so much for having me here today. I'm very excited about this conversation. So for folks who may not know, social determinants of health are conditions in the environments where people are born, live, learn, work, learn, play, pray. And that affect a wide range of health, functioning, quality of life, outcomes, and risks. And it's really important to acknowledge that social determinants of health can be more important in influencing your health than healthcare and lifestyle choices. And also, to define water equity, I really like this definition from the U.S. Water Alliance. And water equity occurs when all communities have access to safe, clean, affordable drinking water and wastewater services, are resilient in the face of floods, drought, and other climate risks, have a role in decision-making processes related to water management in their communities, and share in the economic, social, and environmental benefits of water systems. So just to recap, because I know I threw a lot of definitions at you, where you live, where you work, where you play, where you pray, greatly impacts your health. And access to safe and clean water is no exception. And we know, to add on, here's another add-on for everyone, we know that there's disproportionate impacts facing marginalized communities. And those most at risk and marginalized populations are populations such as children, older adults, communities of lower wealth, and communities of color. So I'll end there. Thanks.
Nathan, I think we lost you.
Mm-hmm.
Can everyone hear me?
Yes.
All right, excellent. So kind of remaining in that topic, what aspects of environment impact public and individual health? And how much can your environment actually impact your health?
Yeah, so I think I'll start with the second question. So according to the World Health Organization, and this is the statistics from 2016, but as much as 24% of all deaths worldwide were attributable to the environment. And when you're thinking about environment and your health, think about your environment. So your homes, the location of highways or hazardous waste sites, wastewater treatment plants. Think about climate change and how that impacts our health and water quality. When there's heavier rainfall and flooding, it decreases the quality of our water and increases health risks. So for example, there's increased flooding, and floodwaters can be comprised of a variety of harmful contaminants. And it can also, in some cases, overhaul a region's drainage or wastewater treatment system, which increases our risk to exposure to bacteria and parasites and other unhealthy toxins. And another thing I'll throw out is just our water infrastructure. So according to the American Society of Civil Engineers 2021 report card for America's infrastructure, our nation's drinking water infrastructure system is made up of 2.2 million miles of underground pipes. That's a lot, that delivers safe, reliable water to millions of people, but it is aging and it is underfunded. And according again to the infrastructure report card, there's a water main break every 2 minutes, and an estimated 6 billion gallons of treated water lost each day in the US. So those are just some examples of how the environment impacts our health.
So a mass amount of factors play into that. That's fantastic. And Kate, another segment for you. What are some of the health concerns that come with lead levels in water?
Yeah, sure. So exposure to lead continues to negatively impact health, and those most at risk are pregnant women, children, low-income individuals, and individuals of color. And there's no safe blood lead level, and even low levels of blood negatively impact children's health. And some negative impacts include learning difficulties, to slowed growth, to ability to pay attention. And, we also see health disparities along racial, ethnic, and socioeconomic lines. So another statistic for you, and I promise I will stop with all these statistics soon, is that when compared to white children, Black children have significantly higher elevated blood lead levels, and low-income children are 3 times more likely than higher income children to have elevated blood lead levels. So when we're talking about lead or just water equity in general, it's very important to look at race and ethnicity as a factor, to look at income, and to really pay attention to our populations who are vulnerable to poor water quality, like some that I've already mentioned.
Great. Kate, would you say that race and ethnicity is a factor that's greatly missed with water quality?
Well, I'm sorry, what was the question?
I just was kind of adding to it that would you say that race and ethnicity is something that is missed when thinking of water quality, a topic that maybe people really don't think of a lot?
I'm not sure if it's a topic folks don't think a lot about, and it really is due to systemic racism and how we have, what kind of policies and practice we've instituted and that are still in practice to this day. So it's really important when you're looking at water quality and public water access and vulnerabilities along race and ethnicity. It's very important to be intentional about that and to look at what policies we have on the books, if you will, and what kind of investments we've made. Where are there regulations that are being violated? And I know I said I would pull back on the sharing of the stats for everyone, but something I really want to share is that health-based violations of the Water Act were more common in poor communities with higher proportions of Hispanic and African American residents. And so it's just really important to be mindful of that when we're talking about this.
Absolutely. Absolutely. Thank you, Kate. And Dr. Kraft, we're going to shift your way a little bit with a question. So what are some common groundwater contaminants in Wisconsin? Where do they come from? And what costs are related to treating them?
Yeah, our major groundwater contaminants are nitrate and pesticide residues. We've done a good job over the past decades cleaning up things like landfills, hazardous waste sites, leaky underground storage tanks, that sort of thing. We've done a good job with those kind of point pollution sources. We've had the rise of PFAS in recent years, and that's concerning, and we need to take care of it. But I think we're going to find that is going to be somewhat geographically limited in scope. There's a lot of the hot places we see now, Wausau, Eau Claire, Marinette. We're going to be finding more of those, but I think that's something we're going to be getting a grip on. And I hate to make a prediction, but maybe 10 years will be in the rearview mirror on this. The nitrate and pesticide issue, that instead of something that we see going away, it's going the other direction. Nitrate is over standards in 10% of Wisconsin wells. In certain counties, it's way higher. That's 20-25%. And we go to things on township and section level, half the private wells below the nitrate standard. And pesticide residues, they are in one of 3 Wisconsin wells, but not necessarily over a standard. So there is a drinking water standard of 10 parts per million as nitrate nitrogen on these things, and we're blowing it at a fair number of wells. Disease, Department of Health Services got a great webpage on us, but we're worried about methemoglobin anemia in infants, birth defects, possibly thyroid and certain cancers, and then there's environmental impacts there. Switching fast here to where is it from? Almost in every case, if you have a well that's past the drinking water standard, it's got an agricultural source. And it's costed a lot of money, to replace the private wells over the standard. The replacement costs for our state, Wisconsin, is estimated at $400 million. Annual health costs inflicted by high nitrate are estimated at $23 to $80 million. And we have these small communities, 1,000, 5,000, 10,000 people. They're having to pony up $1 million to get their community systems right. So it's a large, widespread, and uncontrolled problem that we have right now.
Wow. Yeah, absolutely. And there's certain obvious factors like dumping harsh chemicals out on our driveways. Using maybe more natural remedies to grow grass or other plants and such in our yards. But how can we monitor or prevent those contaminants past that from entering the groundwater?
Well, one of the things is, we all want to do our part, right? And watch what we're doing around our households, things like that. But the fact is, we don't see bad groundwater quality general under residential areas. If we're talking maybe quarter-acre lots with septic systems, things like that, okay, we got a problem. But most of these, most of the nitrate is coming from agricultural fertilizers, and farming operations just lose a lot of the applied nitrogen to groundwater. And this is so tied up into our agricultural system that doesn't seem to be making anybody that happy right now. We have a Gordian knot here to try to untie.
Yeah. And would you say, is there a health cost to this all?
Yeah, for sure. There was a study done. I threw out this number earlier, but in Wisconsin, the annual health costs are estimated at $23 to $80 million. So they're very tangible. Put it in dollars and cents kind of figure. Wow,
that is insane. Excellent. Thank you so much, Dr. Kraft. And shifting now, Dr. Borchardt, I have a question for you. How do individuals get their water tested for possible problems? What can they do to fix the issue if they can themselves? And would these really issues should be left for a professional?
Well, thanks for having me, Nathan, today. Well, there are a number of laboratories, I'm familiar with most of them in Wisconsin, that will do testing at a fairly absorbable cost. Dr. Kraft headed one at the University of Wisconsin, Stevens Point. What is it called, George? The Wisconsin Environmental Analysis Lab?
Water and Environmental Analysis Lab, right?
Well, yeah. So there's labs, like the Stevens Point lab is excellent, the State Lab of Hygiene in Wisconsin. So one can go with an academic lab. There's also one at the University of Wisconsin, Oshkosh, or you can go with a commercial laboratory. Generally, these labs offer what's called a homeowner kit, which tests for things like coliform bacteria, which is not a pathogen, but it's an indicator bacteria. We can talk more about that later. Nitrate, manganese, chloride, pH, alkalinity, those sorts of simple water quality measures that give a good clue to a homeowner how their well is performing. Generally, those kits come with instructions. The homeowner can collect the sample themselves, and oftentimes it comes with a label and can just be shipped right out. So it's an easy thing to do. And it's something that probably should be done once a year, just to keep track of your water quality, because oftentimes the only way you can tell that there's a problem is if there's a change. So it's good to sample once a year and keep that data and track the quality of your water. Now, Nathan, I forgot the other sub questions there.
Yeah, no worries. What can they do to fix the issue? Are there tests possible to do their own, or would this be a job for a professional, which I think you covered?
Yeah, you can collect the sample yourself, but the laboratory analyses would not be able to be done in your home kitchen. Fixing the problem, that's a pretty general question. It depends on what it is. If it's something like what George was just talking about, high nitrate levels, and if it's from an agricultural source, that's a difficult thing to do. If it's a coliform bacteria problem, you may be able to work and find the source. It may be a problem that comes and goes. In general, unless you have good evidence that if you have a private well, that the well failed in some respect, in general, and Dr. Kraft may disagree with me on this, it's not a good solution just to spend the money to drill a new well. Oftentimes, you're not going to get rid of the source that way. And it's too expensive to drill and drill and drill and drill a deeper and deeper well. And at this point, you drill so deeply, you end up in old water that isn't palatable. So replacing a well should only be done if you have strong evidence that the well has failed in some respect. And we can talk more about that later.
If I could build on to what Mark was just saying here, if you have a home well, it's your responsibility to make sure you got safe water and do the testing. If you're on municipal water, our state, every municipal water supply has posted results that you could take a look at, and that water does have to meet standards. There are some issues with lead in certain communities because those don't come out of the raw water supply. They come out of oftentimes the lateral to the house. But if somebody wants to, and you live in a city, you're served by a municipal well, you can see what your quality of water is by looking up at Department of Natural Resources website.
And if I could add to what Dr. Kraft just said, something else to keep in mind is your own health. And that is, if for any reason your immune system is compromised, or perhaps for a treatment it's being suppressed, you need to be very careful about the water that you drink, especially if that water is not disinfected. There are many communities, many public water systems that don't disinfect their water, and many systems like at restaurants and schools that are out in the country don't disinfect their water. So a person needs to be a little bit careful, and what I'm talking about here with disinfection and the care needed has to do with infectious disease and the possible pathogens that can be in that groundwater. So for those folks that are immunocompromised or immunosuppressed, I just would suggest that they take a little bit more caution than just accepting that the groundwater is pure.
And I'll just chime in real quick to say I'm going to plop in a resource from Change Lab Solutions that goes a little bit deeper into the health components, and there's some case studies too. So if folks have some reading time, check that out.
And I'll post that directly into the comments for everyone to take a look at. Thank you, Kate. And Dr. Borchardt, moving on, this was kind of a discussion topic that Dr. Kraft briefly talked about regarding agriculture and farmland, but agriculture is a huge part of rural communities. So what are some of the positive and negative impacts of living in an agricultural-based community when it comes to health and water quality?
Well, I live out in the countryside in an agricultural area, and there's certainly a lot of positive benefits to living a rural lifestyle, some of the things that Kate addressed early on. What I'm most familiar with on my research side are unfortunately, the negative impacts of agricultural systems on groundwater quality. And as Dr. Kraft was talking about, we've got excellent data relating the number of acres of a farm field, for example, around a private well, and the likelihood that that well will be contaminated with nitrate, or the amount of manure spread on a field, how close that field is to a private well, and the probability that that well is contaminated with a pathogen that one can find in cattle and could also infect humans. So unfortunately, there can be significant groundwater water quality impacts by agriculture. A lot of it has to do with proximity, and a lot of it has to do with the strength of the source. And what I mean by that is how much manure is applied, how much nitrogen is applied, and how much area that's applied to near a person as well. So there are negative impacts, unfortunately.
Absolutely. And I'm actually going to switch over to a live question quick, since we're on the topic regarding farmland. So we had a question come in. Someone's asking, after a farm is done working the land, how long do those nitrates stay in the soil?
Interesting thing about nitrate is that it's a very slippery molecule, and so and nitrate residual in the soil will move downward with percolating rainfall and get into groundwater, and so it doesn't actually last in the soil that long unless you got pretty heavy soil, and then it may end up in the top 3 feet for maybe a year or maybe 2, but that's about it. And then for the most of say the state that I live here, Wisconsin, that nitrate is destined to get to groundwater, and there it's pretty persistent under most kind of chemistries. If you have high iron, you probably won't have high nitrate in there, but pretty much anything else, once the nitrate gets to groundwater, it is very, very slow to decay, and we should pretty much think about it lasting forever until it discharges to a stream and leaves a watershed.
Excellent. And then kind of to excuse me, branch into a similar question, what would be the health impacts of nitrates in the water if consumed equal amounts?
I could take this again, but going off our Department of Health Services website, I'm not a toxicologist, so the list methemoglobinemia in infants, which is the original reason why a nitrate standard was set up, but it's pretty much a global standard. Birth defects, we have a lawsuit about that right now as regards to nitrate, and possibly thyroid and certain thyroid disease and certain cancers. Again, our Division of Health really has a nice web page devoted to this, along with the underpinning kind of scientific studies that were done to justify the stuff that they put up on the front page.
And if I could just add to what George said, I think the lesson from the epidemiologic studies the last 10 years or so is that high nitrate levels are no longer just an infant problem. This is not just a blue baby syndrome problem. It's tough to do these epi studies, the epidemiologic work, because it's tough to tease apart drinking water exposures versus food exposures to nitrate. Those studies have made significant advances lately, and now there's good solid evidence for the sort of deleterious health outcomes that George just mentioned. So adults are just as affected by high nitrate levels with birth defects, neural tube birth defects specifically, thyroid issues, and the cancers involved are colorectal cancer. Nathan, we lost you again.
Can everyone hear me now?
Yep.
All right.
Excellent. You go in and out.
Sorry about that, everyone. So switching over to a question that everyone may have an opinion on. Dr. Borchardt, this is for you, but everyone feel free to give their opinion. In correlation to the housing market right now, many people are moving, and do certain environments, climates, or geographic areas pose different threats for those using groundwater?
Yes, they do. I think the bottom line answer there, Nathan, is that at least in Wisconsin, our hydrogeology is very different across the state, and some regions are more susceptible to contamination than others. So for a region that I work in northeast Wisconsin, in an aquifer called the Silurian Dolomite, where people get their drinking water from private wells and from municipal wells, that bedrock, the soil over that bedrock tends to be thin, so there isn't a lot of ability to filter out contaminants before they reach groundwater. And also the rock is cracked, it's fractured. So when contaminants reach it, they tend to move quickly. Another vulnerable area is in southwest Wisconsin, which has a somewhat similar aquifer. It's a little different hydrogeology, but it too can be vulnerable. So the point is that groundwater is not equally vulnerable across the upper Midwest. We have diverse hydrogeologic settings. And I bet Dr. Kraft would like to add something about the Central Sands region.
I would, and of course he's right. Especially when we're talking about. So I tend to think about groundwater contaminants as the dissolved stuff like nitrate, pesticides, that sort of thing. And then there's a problem that I like to think about as chunks. We got chunks of things going to groundwater, and Dr. Borchardt's study, he's examining little chunks, microbes, but sometimes, we're getting wholesale manure washing down these cracks, and people are pulling this up in their a tap. So, we have a situation there where we have the hydrogeology really affects, especially the aspect. In the Central Sands here, it's sands, nitrate, and likes to move right through the soil. But the silt-loam parts of our state are almost just as bad when we look at how many wells are exceeding the nitrate standard. A recent study a colleague did, so what are the major determinants of quality of water? And she did some artificial intelligence kind of stuff. But, the biggest thing is how dense is the agricultural land use in your region when we're talking about things like nitrate. And, secondarily, then, some of the soils factors kind of come in, and what kind of agriculture does as well. But for the things that I work with, largely nitrate and pesticides, not the chunks so much, which Dr. Borchardt has done such a great job with. It's a land use issue, land management issue.
Absolutely. And Kate, I would assume, which maybe I shouldn't assume, that water equity has to do nationwide with geographic locations across the nation.
Yeah, absolutely. I don't feel like I can speak to that. I think the other presenters did a fantastic job about what's going around in Wisconsin, but definitely true across the U.S. as well. Excellent.
All right, Dr. Borchardt, another question for you. What is the typical life expectancy of a well, and what are signs that it has, quote unquote, gone bad? How can a bad well be harmful to an individual's health?
Well, and Dr. Kraft to be able to add to this, we have had some wells in our studies that have been 50, 60, even 70 years old that are still working perfectly fine. So the way to think about a private well is that it's a drilled well. Now, there's different well types, but a standard drilled well is a hole in the ground with a pipe down it, and then the space between the hole and the pipe is filled with a material called grout. The whole idea of that is to get anything on the land surface having to travel all the way to the depth of the pipe before it enters the well. So that's called the casing. And that pipe can be metal, it can be iron, it can be PVC, plastic. So when a well fails, the casing, that pipe can fail, it can crack, it can corrode over time. Or oftentimes what will happen is that material sealing the casing to the borehole, the well hole, the grout, that will fail. Any one of those two fails, that means that any contaminant on the land surface can quickly enter the well. Instead of having to travel that entire distance through the soil profile before it enters the water and enters the well, now it can just go right down the well hole. So the way to assess that is if your water quality changes. If it rains and you get brown water, you probably don't have a good seal there. If you're getting a lot of indicator bacteria like coliform tests, which is a standard household test, easy to do. Coliform bacteria themselves are not pathogenic. They're not going to generally cause illness, but it's an indication. That's why it's called an indicator bacterium. It's an indication that there's a route from the land surface to your well, and that's why it needs to be addressed. But a well-constructed well can last a long time. And again, in general, if there's a water quality problem, if you have a new home, and we've seen this, you have a new home and a new well, and there's a water quality problem, I wouldn't spend the money for a new well. It's most likely a contaminant source problem. There's a contaminant source nearby. George, you want to add to that?
I'm glad to hear you say that, because that has been my observation too, that there isn't a fixed time, that you have to replace a well. I've been kind of bummed with some of our state officials talking about, oh, that's an old well, and no wonder it's got high nitrate. It's like, well, baloney, that nitrate isn't coming because that's an old well. That's coming from some distance away, probably a farm field here. So, and there are things homeowners could do. I don't know how many homes that I was at in a previous career where where's the well? Well, it's in the backyard, and it's in right where Fido hangs out, and does his business all winter and everything else. And there's a loose cap on it and everything else. So, homeowners can go out and see if the cap's on there good and tight. You could, for that matter, if you're going to have the well fail, it's, get a crack or a corrosion, it's usually going to be in the upper, 5-10 feet or something. Well, you could take that cap out, get a mirror, look around down there, make sure everything looks good if you're concerned about that sort of thing. But, it's amazing how many times cap has fallen off, people haven't replaced or it's sitting there loose. And for this, mainly we're worried about bacteria getting down there from, ponding around the well or something like that. So it's something a homeowner can do to make sure their water supply is bacteriologically safe.
Excellent. And, bouncing back to nitrates again, nitrates seem to be a very popular topic with the live question. So I'm going to pull a live question real quick. A individual asked, I live in a rural area with 5 acres surrounded by farms. My well has bacteria in it, and I've shocked the well 3 times. It hasn't helped. I've been buying water for a year now for drinking and cooking. Is there a program to get my well cleaned or a new one dug without the out-of-pocket cost?
That's yours, Mark.
Yeah. Depending upon where this person lives, if it's an area where there's rapid groundwater flow, the shocking oftentimes will not fix the problem. Did you say, Nathan, that this person shocked 3 times?
They shocked their well 3 times. Yep.
Yeah, well, that's a sign right there. In those sort of situations, in the southwest Wisconsin, in the Central Sands region, in northeast Wisconsin, where there's rapid infiltration of the rainwater to the groundwater, shocking is just a short-term solution. So I think there's probably a larger problem there, perhaps with her well, but perhaps more with the source. She said, the questioner said something about being surrounded by farm fields.
Yep. Yeah. Correct.
Yeah. Well, if she's had bacteriological problems, and if those farm fields have a lot of manure applied, that could be the source, unfortunately. And we have seen that. In our research, we have defined relationships between the distance between a private well and a field that has manure applied to it. And the closer a field is to a well, the greater the likelihood to have one of those bacteria in that well. So I wonder if it's more of a source problem than a well problem. But I wouldn't, if this person's already shocked 3 times and it hasn't worked, I'm not sure I'd continue doing so, unfortunately.
I see Melissa who posed that a problem. She didn't tell us where to live, which would be helpful. But to take care of the something that might be the problem, wouldn't hurt to get a well driller or pump installer come out and give the thing a good inspection. See that there isn't corrosion through the casing in the upper 10 feet. Depending, as Dr. Borchardt was saying, if this thing is in the cracked rock in the eastern part of our state, and if the well was not constructed with a lot of pipe or casing in it, that could be the problem as well. So it wouldn't hurt to get a licensed well driller or pump installer out there to take a look.
Great, that's great advice. And is there really anything being done to reduce the agricultural nitrogen use and runoff currently? No. We've been involved in trying to ignore this issue for decades. And it's tied up into the issue that recommendations for farmers are to put nitrogen fertilizer on to maximize profitability here. And at those levels, depending on what kind of soils we're in, major percentages of nitrogen fertilizer ends up in the groundwater as nitrate. Some of the studies that I've done as the central sands of Wisconsin, more ends up in the groundwater sometimes than ends up in the plants and leaving the field. And as I was trying to allude to earlier, this whole thing is caught up in how do we have a goal. We want to keep family farms on the land. We have policies that encourage more production even when we don't need it. I mean, the whole ethanol and gasoline is one of those things that it's not something that makes a lot of energy sense or environmental sense, but it does keep people in business growing corn and things like that. So, I hate to say it, but in the big picture, we need to think about what the agricultural future looks like, for our drinking water, groundwater, surface water, and for that matter, things like the dead zone in the Gulf of Mexico and algal blooms in the Bay of Green Bay. Right. And another live question, do we have a sense of what percentage of Wisconsin private well owners have tested their water in the past 10 years, and what percentages of those test annually?
I think Dr. Kraft could address that, given, George, do you want to mention the well water viewer at your former center?
Oh, sure. We could talk about that. But first, I don't really know how many test annually, if at all. We did some survey work a decade or two ago, and it was really minuscule number of people did it at all or on a regular basis. I think that's improved. But thank you for the plug. We have something that you could Google up pretty quick called Wisconsin Groundwater Viewer. And on there, we have all the analyses that our extension lab has done for a few decades, plus the nitrate data that have been coming from Department of Natural Resources and Department of Ag, Trade, and Consumer Protection. And we've aggregated all that in there to a tool that will map that for you. And so, if you're curious, you can look at what the average nitrate concentration or the nitrate standard exceedance rate is at the county scale or a township scale, or you could zoom way in and see it at a 1 mile by 1 mile section level. And the tool and the people that put it together, they really have helped with the understanding of where we have nitrate issues and where people need to be most concerned about it.
And if I could add to that, the person who asked that question, I published my first study on private wells in 2003, and it got some attention. But now, almost 20 years later, the interest in private well water quality, it's just grown exponentially, especially the last 5 years or so. And so what I've noticed is many counties in the state of Wisconsin, and actually in Minnesota and Michigan too, many counties are running private well testing programs. And sometimes these are at no cost to the homeowners. So the person who asked that question, they might want to call their county and see if they plan to run a well testing program in the future, or maybe even encourage the county to do it if they haven't already done one.
That's great advice. Kate, we have a question for you that came in. What are some ways the general public can become involved in improving water equity for everyone?
Oh, that's a great question. Yeah, so I think one way is just to be informed. I don't know as much about Wisconsin, so I'm sorry if this doesn't apply, but if there is lead service line replacement happening, really look at your communities of color first of replacing and their lead service line and do a full lead service line replacement. You could really look at the water affordability in your state and try to have conversations of payment structure, especially for communities that are of lower wealth. Another example of water equity that I like to encourage is, this might not apply to folks who don't work in public health, if you will, but, you know, really start talking to all the partners involved in water and in health equity and try to make a strategy together. I know on a national level, APHA is a member of the Lead Service Line Replacement Collaborative, and that group also has water utilities at the table, and we talk a lot about how can we partner together to really encourage this full lead service line replacement, as well as applying an equity lens. And so there's plenty of success stories on the website, the Lead Service Line Replacement Collaborative. So those are just a few off of the top of my head that I can think of, but I'll keep thinking to see for general public. Oh, and my last one, I can't believe I didn't start with this, is, you know, always look at if there's open comments available on either EPA's website around like the Clean Water Act, or at your state level, if there's comments that are that you can provide as a citizen about how you can increase water equity within your state, or same thing within your locality. That's always an opportunity for you to really make sure that your voice is heard.
Excellent. And we had another live question come in. So, can campers and recreational folks be confident in the quality and safety of water supplies at Wisconsin county and state parks?
Those are public water supplies that do get an evaluation. At least they have to take a test once a year to meet standards. And it used to be that a DNR inspector would take a look at these things once a year. So me personally, I drink from them without giving it a lot of worry.
And for me, well, what I do is I take a look at where the well's located relative to the septic system. And if the two are nearby, I won't use it. So septic systems can be a very large contamination source for wells, including those public water supply wells at camps and parks and things. So that's what I look at. And then I would just reiterate what I said before. If a person is immunocompromised, if their immune system is not fully functional for whatever reason, an illness or treatment, I'd be very careful about drinking non-disinfected water.
I think that's great advice. And we had another question, and actually this was a question I was curious about that I wanted to ask, but someone beat me to it. Can water taste and look fine but still be contaminated?
Well, that's from Chris Mechanic. So George, that's you.
And that's a good point. Yes, water can look and taste fine and certainly be contaminated. You can't taste nitrate. You can't taste the low levels of pesticide residues. I don't think we can taste viruses and bacteria very well. So yeah, Dr. Borchardt was talking about if you see a change in water quality, it's something that you should get your antennas up, but don't rely on it while it just tastes the same as an indicator that everything is hunky-dory.
Excellent. And we have another question, and this is a broad question regarding water in the West. Does anyone have an opinion on the water problem in the West? Solutions, ideas?
Well, I got an opinion anyway. Remember, I don't know, this was the California drought 7 years ago or 8 years ago, and God knows how many there have been, once in a century droughts since that time. But what I was struck by in these water tours I took to California is, the system there is nuts. And I think it's similar for, large projects in the West. So, long story short, in California, agriculture is 2% of the economy out there, but it uses 80% of the water. And in doing so, we're we have killed off salmon runs and all kind of critters and things that are out there. And nobody's thinking about how do we right size this thing. What would happen if we said, if we got agriculture, we're going to make some permanent changes on the landscape, folks, because it doesn't look like there's going to be enough water to go around in the future, given climate change scenarios and things. It's like, what would happen if we back off the water use in that sector by, 20%? Can we still keep a huge amount of that economy, or in the terms of the overall California economy, it'll be pun not intended, a drop in the bucket. And I think we just don't want to deal with these difficult questions. We don't want to think about with some term like a climate change retreat when climate change is the dominant driver there. And it's time that we need to take a look at that, in my opinion.
And I'm just gonna hop in and say we can also think about like water in the West, about our migrant and seasonal farm workers, and they experience higher rates of inadequate access to drinking water and basic sanitation. And findings from a 2015-2016 National Agricultural Workers Survey suggests that more than 90% of surveyed farm workers had access to water for hand washing, drinking toilets, and workers who were either undocumented or hired by piece rate were significantly less likely to have the same access to water. So when thinking about water in the West, also think about, in agriculture, we also need to think about the workers and how this restricted access to water for drinking, sanitation, hygiene can spread to intestinal parasites and bacterial and viral diseases. So that's another consideration.
Definitely, thank you. And so we have two more live questions, and well, three just came in. we have three live questions, and then I think we'll close. But if anyone has questions even after the event, please submit those, and we can send those out to Dr. Kraft, Dr. Borchardt, and Kate for answers post-event. But another question, kind of going back to camping, and Dr. Borchardt, I believe maybe this person got this question based off what you said. Do you have a list of parks that currently have septic systems too close to their wells? And what is the recommended minimum distance?
No, I don't have a list. I think the recommended setback distance, and George, correct me if you know, I think the recommended is 100 feet. But a lot of times those setback distances were established by a sort of a by gosh, by gum method. as opposed to based on anything hydrogeologic and the transport of these microbes. For me personally, a lot of times in these parks, the well is right next to the septic system. And it's within 50 feet. And for me, I'll go to a well that's a little bit further away. That's me. And that's my choice, given what I know about septic systems and well contamination. But please don't hold me to it. But I think for a public water system well, I think the distance, the separation distance, I think it's 100 feet.
I can't tell you what our friend Christine could chirp up and give us that number in a second here. But those wells, because they are public water supplies, are supposed to meet whatever the code is. But yeah, I think what I hear Dr. Borchardt saying is that, well, the code may not be sufficiently protective. And he talks about all this scary stuff about viruses and bacteria. I'm very prone to listen to him.
Well, we know for those systems. I mean, I just am going to submit this paper this week, George. We know for those municipal systems in the state of Wisconsin that do not disinfect. So these are municipal systems that do not disinfect their groundwater. We know that 10 to 20% of the gastrointestinal illness is from their drinking water. So at any time, especially for kids less than 5, young children are especially susceptible to these infections. And so, and these are healthy people. These are not immunocompromised or immunosuppressed people. In our epidemiologic study, these were healthy enrolled individuals. So we know that there's groundwater-borne disease transmission, and we can measure it.
If there's epidemiologists that are very curious about that, Mark really did some groundbreaking and clever studies about this, and I think you'd enjoy the papers that came out of that work.
Oh, thanks for the plug, George. I owe you a beer.
Excellent. And we had some help from one of our viewers to answer a question, but I still want to ask it for everyone. And this will be our final question for today live. But if a person is immunocompromised, do they have to disinfect all water? Or if a well is tested and no contaminants found, can the person just drink it?
I guess I'll address that first. In general, if this person is doing a coliform test, which is the standard indicator, and that test has always been negative, that test is very good at indicating then that there isn't a problem. So you have to, if it's always negative, that test, it's very, very good at saying there isn't a problem. If the test is positive, there's usually a 10 to 20% chance that there's a pathogen as well. The coliform isn't a pathogen, so it's a 10 to 20% chance. If the person hasn't had any problem with their private well, and their immune system is a little below optimal, and they haven't had a problem, I wouldn't change anything. But interestingly, while the groundwater is invisible, what is visible is what happens at the land surface. And if anything is changing on the land surface that this person thinks that there could be new contamination, like a neighbor with a septic system, more manure applied to a field, a new landfill, then yes, I'd be concerned about that and would consider disinfection. And usually an RO system, a reverse osmosis system, is affordable for most people.
Excellent. And real quick, I will ask one more question. But if everyone could maybe provide, if they have any recommendations for water filters to be using, if anyone has any.
Kate or George?
Well, first of all, if you don't have a problem, I wouldn't worry about it. If you're high nitrate and you're below about 20 parts per million, you could do a reverse osmosis. You get higher than that, now you got to go to some other kind of technology. And then everything after that, if it's an aesthetic concern like iron or something like that, something off the shelf, make sure that it is a approved device. There's a list of these that the state keeps, and I don't know what you do if you have microbial contamination, Mark.
Well, reverse osmosis is a good solution because it not only handles nitrate if it's not too high, like you said, George, above 20, but also any pesticides, any herbicides. It handles viruses, takes care of viruses, takes care of bacteria. So it's a good solution for contaminants. What people need to understand, though, is it's not you put it in and then forget about it. It does have to be maintained. So you can't put it in and then 20 years later wonder about it. Usually it's an annual event of changing the filters, which is not terribly expensive.
Right. Well, I want to say thank you to you all. And we have 4 minutes roughly until 1 p.m. Central. If anyone has any closing remarks, I'd love to hear any of those.
Well, I've got something in mind that I would like to say, and I'll keep it brief. And that is, groundwater is a bit of it fits the classic problem of what's called tragedy of an open access resource. That is, a homeowner with a private well pays for the well, they pay for that infrastructure, they pay for the property taxes for the value of that well, but they don't control the groundwater. That's shared. It's shared amongst everyone. So it's important to keep in mind that it's a shared resource, not unlike a lake. Now, a lake you can see, it's very obvious that the homeowners around that lake share that lake. It's not always obvious with groundwater. So keep in mind that what you and your neighbors do on your land affects the groundwater quality. That's what the message I would like to leave with.
Good one.
I think, did Nate go dark again?
No, I'm here. Kate, do you have anything?
No, I just wanted to add, I loved that you went first because that was very public health. I love it. I just, I think it's a very important reminder that we're all part of a larger community, and we have to really consider how our decisions impact health, and if we want to achieve health equity. And why wouldn't I end with a definition? Which means everyone has a fair and just opportunity to be as healthy as possible. We really need to lead with equity and work across sector and work for stronger policies and stronger regulations and enforcement and increase our workforce in this space. And I can go list on and on and on. But just, I hope that from this conversation, you were able to learn a little bit more about the health impacts of water quality. And I know I learned so much on this webinar too about private wells and groundwater. So thank you for the opportunity.
Thank you so much. Dr. Kraft, any last? I didn't know if you had anything.
I'd like to have some concluding remark here, but the other two were so good that I'm better off not saying anything.
Well, thank you to all three of you, Kate, Dr. Borchardt, Dr. Kraft, for taking some time out of your day today to join us and really just inform the general public more about all topics regarding water quality in our environment. So thank you so much.
Okay, thank you.
Thank you for the invitation.
Absolutely. All right. Have a great day.
Bye now.